Addiction creates two people, the one before addiction and the one after. And without an effort from the one before addiction, he dies. And all that is left is the addict, while to resurrect the before one takes almost an impossible effort. Hello, welcome back to the channel. If you're new here, my name is Yakub. I'm a holistic practitioner in all the 14 dimensions of health and wellness. Today, we're going to talk about the sides of addiction. Addiction is a mental disorder defined as a pervasive and intense urge to engage in harmful behaviors in providing immediate pleasure despite the harmful consequences. However, dependency is when addiction is coupled with body presentation of symptoms, i.e. withdrawal, after stopping the harmful pleasure-seeking behaviors and substances. Addiction can be due to substances or behaviors. Substance or drugs that can lead to addiction are alcohol, the most famous, tobacco, otherwise called nicotine, marijuana, mirror, amphetamines, cocaine, painkillers, and even food. Behaviors that can lead to addiction are gambling, video games, social media, shopping, pornography, sex, and masturbation. The difference between substance and behavior addiction is the one of substance lead to change of the brain structures in time. Addiction, mainly due to substance use, causes physical illnesses, mental illnesses, poverty, aggression, isolation, divorce, road traffic accidents, sexual abuse, prostitution, criminal activities, childhood trauma, and death due to overdose on drugs by taking too much of it. The brain has a reward system that evolved to serve biological, essential, normal, rewarding behaviors such as feeding, drinking, sexual behavior, maternal and paternal behavior, and social interactions, i.e., the more you do of these activities, the more pleasure you receive. The reinforcement engendered by such normal reward is believed to underlie the consolidation of biologically essential memories, for example, food and water locations within animals foraging or hunting range. Addictive drugs or behaviors hijack the brain's reward circuits, activating them more strongly than natural rewards and diverting the drug addict's life to the pursuit of drug-induced pleasure at the expense of getting high on life's normal pleasures and rewards. The body always lives in a state of balance called homeostasis. So the more pleasure a person receives, the more pain they also feel, which is why when you feel bad or sad after pleasurable activity like social media scrolling, if you wait for a while you recover, but if you rush back to look for more pleasure, that means pain is building up, and as soon as dopamine is finished, you would end up depressed. The substance that operates the reward system is called dopamine. The more someone repeats a behavior, the more reinforced that behavior becomes, creating a feedback loop. After a certain amount of time, a physical change occurs in the brain, altering the reward pathways permanently. The amount of time it takes for such change to occur depends on the type of substance being used. This could be after one's use or for months. Change in the brain due to reinforced behaviors are highly influential when a person transitions from casual use of substance to addictive substance use. The persistent release of dopamine during the chronic drug use gradually rewires the specific brain structure embedding drug use, which leads to obsessive cravings for the substance. These changes are what makes a withdrawal so difficult due to depletion of dopamine. Hence, the person feels a lot of pain at the same time and will need more amount of the substance or behavior to have the same feeling than before, leading to tolerance. That's why someone jumps from a minor stimulant like marijuana to a major stimulant like methamphetamine or painkillers to become high. There is a personality types that make a person susceptible to addiction. According to the most credible personality test, the Big 5 personality test, people who are high in extroversion, openness, and neuroticism are more susceptible to addiction, while those who are high in conscientiousness and agreeableness are least susceptible to addiction. By the way, you can take a free Big 5 personality test by clicking on the link below. There are other risk factors for addiction like family history of substance addiction, which could be genetical or exposure to the substance as a child. Childhood trauma can also increase the risk for addiction, possibly as a consequence of a parental abuse of drugs. Stress can easily force a person who's recovering from addiction to relapse back to the substance or behavior because it inhibits the new nerve cells that are built to stop the addiction. Also, happiness can do the same thing to a recovering addict. You could have seen someone who was dealing with one of these addictions. As soon as maybe there's a big event in their life, like they're celebrating, it's easy for them to fall back to the substance which made them addicts before. Addiction is a complex disease with a combination of psychological, social, and physical change in a person. Hence, it requires a holistic treatment. The person who is an addict has to have an insight into his or her situation and be willing to put an effort to fix the addiction, because the withdrawal period in the first 2 weeks is the worst, with symptoms like pain, vomiting, diarrhea, hallucination, anxiety, insomnia, depending on the substance they were addicted to, which is why some addicts are given medications to lessen the withdrawal symptoms. The most effective therapeutic methods for addiction are combination of cognitive behavioral therapy for disabling the harmful behaviors, motivational interviewing for empowering the person who's dealing with addiction, and group therapy to provide support, for example, Alcoholics Anonymous, AA. It takes years, possibly forever, to recover from addiction and not to relapse. There are a couple of things you can do to prevent a behavior from becoming addictive. Enjoying boredom by accepting reality for what it is. Finding a pleasure in small activities like spending time with family and friends, as well as reading books. Avoiding lying because it predisposes you to harmful behavior. The truth shall set you free. Choose your friends wisely, sometimes even relatives who might either expose you to the substance or make you sponsor their addiction financially and emotionally. Seeking natural activities like exercise and not just digital ones like social media. Finding healthier ways to manage stress like via sports or hobbies, even cleaning. Having goals to align your life with and be accountable to those goals with the help of someone you trust. Not falling for your ego and delusions that you have control over your addiction and seeking help. Having prayers and gratitude keeps reminding you even in the worst times. Having principles and values which you do not compromise whatsoever. So if you have one problem currently with your health, work, education, finances, relationships, parenthood, or life in general, if yes, please feel free to talk to us in an effort to find a solution based on our expertise and experience in counseling and coaching together. Book a free 30-minute consultation by clicking on the link below. Thank you.